Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the first line of healthcare. I'm your host, Dr. Pamela Reed, and I'm thrilled you're here with us. Whether you're a healthcare professional, someone passionate about wellness, or someone who's looking to gain more knowledge about your own health and well-being, you'll find stories here that resonate, educate, and inspire. This podcast was born from a shared truth. Healing isn't just about medicine, it's about connections, listening, and leadership. And who better to lead these conversations than women physicians? Our disclaimer is this information shared on Healing with Her is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and do not necessarily reflect those of their institutions or employers. So today, we want to do a follow-up episode to our last episode on healthcare enrollment. Today with me I have Dr. Emil Nylander.
Hello.
Dr. Teresa Rush.
Hello.
And our guest, Elise Robinson.
Hello.
Elise is with us today as the Director of Community Health at Niagara Health Center. Neighborhood Health Center, excuse me. So, Elise, thank you for joining us.
Thank you for having me.
So, in our last conversation, we did get information on various types of insurances, the fact that open enrollment starts November 1st, the reasons to have health care, with it being one of the reasons that people have their most financial debt is connected to lack of health care and those bills that accumulate when something catastrophic happens. And so we wanted to follow up and do kind of a deeper dive into healthcare insurance and open enrollment to give our audience more information about actually how to do this. We know the importance of doing it because you really need to have health share for those times when something happens that you didn't plan for. And so let's just recap. What is health insurance open enrollment?
So health insurance enrollment or open enrollment is the time period where either you're newly enrolling into insurance or you've already had insurance and it's time to renew it. Just like when you do open enrollment with your employer, it's the same concept, but this is just on the state and federal level that you're enrolling into insurance. So New York State's open enrollment period is from November 1st, and it goes through, they've extended it, so it goes through January, usually by January 31st. If you've never had insurance with the state, this is your time to enroll. Also with new Medicare recipients, if you've never had Medicare, this is your time to enroll into those plans. So, like I said, whether you're newly enrolling into the marketplace, and this is for individuals that may have not had insurance or lost their insurance, they're no longer working and need an alternative plan. So this would be that time to do that.
And then is there a particular age of people who can enroll in health insurance during this period?
So anyone is eligible, newborn baby, unborn child, mom, so the whole family can now enroll into insurance. Of course, if you are disabled or have a disability or over the age of, 65 and you qualify for Medicare, you would be enrolling into that type of plan, a Medicare plan. If you're younger than 65, but you're on disability, there's still some plans that you can get into that you may not have to opt for the Medicare plan, but if you're eligible for Medicaid, you can do that.
Okay.
So this is now the opportunity for anyone who needs insurance to enroll.
Okay. So describe how that process differs. You said it's for those who have insurance, as well as people who don't have insurance. How is that different in terms of enrollment?
So those that are already enrolled into a plan, so there's a few things that may be happening. They're renewing their plan if they're still eligible for it, or now they're renewing and going into another plan. So children are eligible for Medicaid and Child Health Plus. Adults are eligible for Medicaid, Essential Plan, and a Qualified Health Plan during this time. There are special enrollment periods. That's if someone, like I said, lost their insurance. This is outside the open enrollment. If they've lost their insurance, that's considered a special enrollment. They're married. Household size has changed because of a new addition to the family or something like that. That's a special enrollment period. And they can do that enrollment throughout the year. So you can enroll into Medicaid, Child Health Plus, or an essential plan throughout the year. Special enrollment, which is now, or open enrollment, which is now, are for those qualified health plans, or if you've never had insurance through the state.
So what if I turn 65 and I've just, been getting my regular plan? Once I turn 65, can I then go and apply for Medicare? And is that a special enrollment?
Yes. So once you reach that age of retirement, you can now go into a Medicare plan, and you want to take advantage of the open enrollment period because you can be penalized if you don't. A lot of people sometimes miss that, and we don't want them to miss that time. That, especially, like I said, that open enrollment time to get that insurance done.
Now, if you qualify for Medicare by age, and let's say you are married, do you have to go into Medicare or?
So, no, you don't have to go into Medicare. You can decline it, but like I said, you can be penalized later. So if you needed it, or the process will take a little bit longer to get enrolled into Medicare. Like if your spouse, you're at that age, you're retired, but your spouse is still working, and your spouse is carrying the medical insurance, you can you can have it. I would just encourage those that are eligible just to go ahead and apply, because you don't want to be penalized. Which, when I say penalized, they're actually, like I said, they'll delay the enrollment into Medicare plans, or there still will be a deduction for it until you get it.
So you can have both.
Yes.
Is what you're saying.
Yeah. But just make sure that you notify them that you're of Medicare age.
Yes.
Okay. All right. I did not know that.
So, so anyone that is under the age of 19 qualifies for Medicaid or a Child Health Plus plan. If they're over, any adult would be Medicaid, an essential plan, or qualified health plan. The differences with those plans, of course, is based on income. Essential plans model Medicaid, but there are some little to no copays. So what individuals in those plans and families are seeing now is that they have a copay when they use that plan, either to the pharmacy or their provider, which, when they had a Medicaid plan, they may not have had a copay at all. It was covered. Mm-hmm. Or if they did with a Medicaid plan, it was like under $10. So it was like $2 or $3 or $1. Essential plans, they may not have a monthly premium, but like I said, they may have some form of copay for your medication, or if you go to a specialist, so there's like a $20 copay. And for a family that's never experienced that or had to do that, that's quite an adjustment for them.
Yeah.
So they're still getting a lot of the same coverage, but now there's some fees to it with those essential plans. And but you do get the essential plan for the year. What I would tell people as far as open enrollment is to just be honest about income. I know not everyone wants to report everything because they feel like, is that going to make, is that going to not make me eligible, or am I, what will I be eligible for? There's a little anxiety when it comes to enrollment into insurance.
So tell us what documents. So you're going to enroll during open enrollment. What documents do you need to gather to prepare for this?
Yes, very important to have Social Security numbers if you're citizens. If you are someone who has residency here, you want to have those documents too. You have to give that information, your document number, visa number, or any temporary numbers that you have that are assigned to you. Social Security number, any demographic information. You want to have up to date address. That's another reason why we see people have to re-enroll into insurance, because they did not update their address. So you're having a valid mailing address, and then, of course, income information. If you are an entrepreneur, your tax information is probably the best way to report that income. If you're employed, you just need pay stubs, at least 3 to 4 pay stubs, depending on how you're getting paid. If you get paid weekly, you just need 2 or 3. If you get paid bi-weekly, I would say 3 to 4, just to cover it.
Can you use your tax documents
You can
as
use your tax
verification of
documents.
incomes? Okay.
So one of the things that the state system has done is try to make it easier for anyone or enrollees that if you file taxes in New York State, the systems communicate with each other. You can opt out to have the state use your tax information based on what's been reported to the IRS. I encourage individuals and families to just use it, and it's only for income purposes. And if it changes, you can always correct it. But it makes the process smoother to navigate through and get that enrollment done.
And approaching Medicare myself age, can you explain what IRMA is, where they are looking at your finances, and it varies by what you make,
So
what you pay?
I'm going to be honest. I'm very minimal Medicare literate.
Okay.
So I know the basics of enrollment for Medicare, just because it is very intricate in how you apply through Medicare and what you qualify for and what the best plan is for you, and what is accommodating to you and your family, because Medicare plans are definitely much different than the qualified health plan, essential plan, and Medicaid plan, Child Health Plus. The coverage, that's another thing too, and it's unfortunate because the Medicare plans may or may not cover the specialist that an individual will see. And people are paying more out of pocket to have those plans, either for the premium that's coming out of their, Social Security, and then there's the retirement Medicare plan. So depending on what your employer has set up for you, those plans are a little bit different and may offer more coverage than you enrolling into a plan on your own. But that's about all I can give you with it.
So, no, that's good, because I think a lot of individuals go into it not knowing that they have to notify at their age of 65, and it's very confusing. Plan A, B, C, D. I'm like,
I think that's why it's more important for you to go to and find someone who can just make you understand what is best for your family, for you and your family at that certain stage. So bring the documents, and where would they go to talk to?
So there are navigators and brokers that are available. If you are technology savvy, I would say just do a search. And you can look up, a New York State application counselor or assister, or you can look up Marketplace Navigator. Okay. The county has navigators, and there's individuals that assist with enrollment into Medicare plans. And then there's different companies that also assist with that. Lawley is one of them. They have brokers that can assist with Medicare plans. And the good thing about that is that they're not selling any particular product. They're not biased to any insurance company. So if there's something that you might have done some research on, they'll go ahead and enroll you into that. But the insurance companies also have navigators or assisters that can do the enrollment into Medicare plans as well. It just depends on what you're looking for. Now, like you said, individuals, families should do some research based on what their needs are, and then work with a broker that can help you align your needs to what those plans are offering. There are a number of plans that are available that can be cost effective, but also provide the coverage, as much coverage as you possibly can get to keep it affordable.
Right, so I'm going to say some people, especially in our demographic, the three of us, not you, are just not tech savvy. Like they don't know how to research, right? They don't know how to do these things. Is there someone who will actually go through all of that? Like you go to them and say, these are the things that I'm concerned about. I'm concerned about the possibility that I might have to be hospitalized because I've been hospitalized 3 times last year. This is in applying for Medicare specifically, or I have to see a number of specialists because I have these conditions. Or these are the medications that I'm taking and I want to make sure that are covered. Is there someone who will just sit down with you? Because I imagine this takes a long time. It's not something that's a quick 30 minutes. Is there someone who will sit down with you and actually go through all of that, even if you've done no research, you just know what your needs may be?
So any patient or individual in the community that may not, like you said, they're not technology savvy, but they know they need some assistance, you can ask your medical provider if there's anyone in the clinic that can assist. Some especially FQHCs around here, they have assisters or enrollers right in the clinic that can assist. If a provider or any hospital that has a financial counseling center, they have someone there that can help with enrollment. Or if they don't do the enrollment themselves, they can at least connect you to someone who specifically does Medicare.
Okay.
Like I said, there are navigators and brokers that are around the area that will assist with enrollment into Medicare. But I know the first step is getting connected to someone like that does financial counseling with insurance, and they can get you connected.
Okay.
There are a network of people, and then like I said, if there's a specific insurance company because I know some are biased to the coverage that they've had with their insurance company. So to say they had independent health while they were with their employer, now they're retiring, but they want to stay with independent health. Independent health has, assisters or navigators that can assist with enrollment into Medicare, just like all the other insurance companies.
Okay.
So
I know back in the day we had this experience where young women would come to Buffalo, new to Buffalo, no insurance, pregnant, and they needed to get insurance and hooked up with some sort of service. We would send them to the emergency room of any hospital because we knew that's where those navigators were, and they would get them signed up for insurance, get them set up with the clinic there, and so that was the easiest way for them to get into the system.
So there are, of course, there are a number of programs. Shout out to Buffalo Prenatal. They work a lot with expectant moms and women who have children 0 to 5, and they provide those services as well. They can assist with those wraparound services and getting them insurance. But like you said, yes, any emergency room, there are facilitated enrollers that can assist you into insurance. Pregnant moms or anyone without insurance or underinsured, they can assist with that. And a lot of the clinics are now expanding their services and providing or having a facilitated enroller right there in their clinics as well.
Which is really helpful.
And the county does facilitated enrollment. The Medicaid division has shifted, so they're now doing facilitated enrollment as well.
Okay, so you can just contact the
So
county.
you can contact the county.
That's good to know.
Okay. specifically, when you say contact the county.
Erie County Department of Social Services.
Okay. Thank you.
Thank you.
Very
Thank you
specific.
very
Division.
much.
But there is the New York State Marketplace. Like I said, if you're comfortable with applying on your own, you can go to the New York State Marketplace website, or it's newyorkstateofhealth.gov, or you can search New York State Marketplace. That'll also pull it up. You can also contact them via phone and just go through the prompts, and that will also connect you with they call it the contact center. So they also do the enrollment. They also can help with finding a navigator or enroller in your area. So as long as if you're in New York State, you can be anywhere in New York State, but if you move from one county to another, they can assist with locating someone in your area.
That's helpful to know. And I love that the Buffalo prenatal will help expectant women. So that's a great resource as well. Questions, Dr. Rush, that you thought about?
Oh, just a comment. I remember when my dad moved from New York City down to Virginia, I think I might have called out of desperation. Maybe their health, insurance agency, and they were really nice in terms of offering different ones. And then once you told them what their needs were, they basically said, "Okay, I think this might be a better fit for you." So
definitely, each state is a little different in how they handle it and how they do enrollment. And most states, I would say their open enrollment is around this time as well. It is different going from one state to the next and how to navigate through those systems. We're fortunate New York State is very just one of the leaders and want to be in the forefront in like providing coverage for all. We have about from what I understood, the data and the statistics is that we are close to 90% of individuals in the state that are covered with some form of insurance.
That's amazing.
yeah,
So
That really is good.
definitely like one of the forerunners in maintaining coverage and keeping New York State people in New York State insured with some form of insurance and trying to keep it affordable. That's not to say that it's always affordable, because like I said, they're qualified health plans. They are different plans, and those plans were set up for like small business owners or entrepreneurs that needed health insurance coverage, and maybe it's affordable. There is a maximum, there is a cap as far as like the cost of it, and it might be cost effective for those individuals. But when you have people that are like your working population, everyday person who now does not qualify for a Medicaid plan or an essential plan, have to move into a qualified plan. If you don't, which we know there's a lot happening right now around insurance, but if they qualify for the tax credits, that helps bring that monthly premium cost down. So the good thing is the state created a plan called, it's a silver plus plan, which the premium is a lower cost, basically on the same line as a bronze plan. So you go from bronze, silver, gold, platinum. Of course, the higher you go, the more coverage you have, but what to look at is the deductible.
Yes.
The deductibles are very high when you go with a more cost-effective plan. Like your bronze plan is probably the cheapest, but that deductible is very, very, very high.
Can you explain deductible
Yes.
for
Whew.
our friends
I know,
out
that's a
there?
big one.
Yeah, it's a
So-
big one. Yeah.
And this also works with Medicare plans too. So individual who is low income and say they make $900 a month, say we'll go with a low income person. $900 a month is their monthly income. Their health care cost is $1,010. So you have Medicare. Medicare says we will cover your prescriptions and whatever, but you need to apply for Medicaid. Well, Medicaid says, well, you're over the income, but now you have to show us that your medical cost is more than your monthly cost. Well, if that person has $900 a month, but the cost is over $1,000, Medicaid says, okay, show us your medical bills, and then now your deductible will be to meet it $100. So as long as their bills are higher than their monthly income, they now have met that. So I'm going into another lane, and I don't want to get too deep into it because I'm like, okay, I'm going into a different lane. But for the average person who has a high deductible plan, it's like car insurance. When you get into an accident, you have a deductible of $500. Well, you have to pay that $500 up front first before the insurance will cover the rest of the cost. It's the same thing with the insurance. The average person is paying a $1,500 deductible for an individual, about $3,000 a month or $3,000 a year for a family. So what people are seeing is they have their copay, which may be one thing, and now you're paying towards a deductible. So that's an out-of-pocket cost for your insurance coverage. Once you meet the deductible, then all you're paying are the copays. So someone who sees a lot of specialists, you're paying your specialist copay plus whatever, whatever you need to meet your deductible, which, and I look at it like, some people are not fortunate to have that extra money to pay that deductible, but that's the only plan that they can get. So again, in situations like that, if you are able to afford it and meet your deductible, that's great. I'd say if you're employed and you have a high deductible plan, take advantage of the HSA plans that your employer may offer, because that helps with the cost. That helps with copays. That helps with pharmacy fees. And even though, you're paying a little bit each pay period into that, and if your employer meets it, then that's one less bill that you have to worry about later.
Right.
And HSA is the health savings account?
Yes, health savings account. I definitely encourage anyone to take advantage of that.
But not all plans have that.
Not all plans have that. Okay. Not all employers offer that.
Right.
But if you're one that's fortunate to have that, I say take advantage of it. Especially if you don't budget for those unexpected bills.
Right.
And those HSAs are pre-tax dollars,
yes,
correct?
Pre-tax. The other thing too is there may be, again, even if you're, I know families and individuals are also maybe accruing bills from their health care altogether, and they get medical bills. Also, you can always look into if your insurance plan has any savings plans, because sometimes that's possible, and they'll offer something back to you, or whoever you are getting medical bills from, a specialist, hospital, whoever, always reach out to their financial counseling or their enroller to see what they can do to assist you, whether it's sliding fee scale or something to help reduce the cost and what you owe. Every institution has something set up. When you go to Roswell, you go to Kaleida, any Kaleida Health Center, they all have something, even ACMC, they all have something to help, support and bring those costs down. You just have to ask for it.
So we're going to wrap up. If you have one thing that you would tell people about this open enrollment, I know it's a lot to tell them, but if you had one thing that you thought was really important about the open enrollment period, what would that be?
Well, I probably have two things.
Okay.
First thing is, don't be afraid to apply for insurance. Even if you get denied, circumstances always change. Income, and the state has increased the income guidelines. So if you didn't think you qualified before, you can always, try to apply and see what you qualify for. Maybe more cost effective than what you are, whatever current plan you're on. People are under the impression that if they lose their insurance with the state, that they can't get insurance with their employer. you can. You just have to show proof. That's now puts you in a special enrollment period, even if it's your employer. So if you, or vice versa, you can also apply with the state if you lose it through the employer. So I encourage anyone and everyone to apply, not to be afraid. I also just say, have as much information as you can possibly have to do the enrollment. It takes literally 15 minutes to do an application if you have all the information. If you don't, it could take longer. But I encourage everyone to take advantage of, just take advantage of the special enrollment time, which is now, or open enrollment time, which is now, but there's always special enrollment throughout the year, so don't think that you can't apply. But again, it just depends on what you qualify for.
Well, thank you so much, Elise. This was so very helpful.
Thank you.
We
Thank you
really
for having me. I
appreciate
appreciate
you coming in and speaking with us about this. So this brings us to the end of our episode of Healing with Her. We hope you found the information enlightening and empowering. Please subscribe to our podcast on YouTube, follow and like us on Instagram, and share with everyone you know. The information shared on Healing with Her is intended for educational purposes and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other healthcare provider with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and do not necessarily reflect those of their institutions or employers. Thank you so much for joining us. We will be going on a hiatus for the holiday season, and we'll be back with you in January. Thank you.